Hello everybody, in this video we are going to understand the difference between the nephrotic syndrome as well as the nephritic syndrome. The only differentiating letter in both these words is the O in the nephrotic syndrome and the I in the nephritic syndrome. Now let's look at nephrotic syndrome. The P in the nephrotic syndrome is before the O and the P in the nephritic syndrome as well is before the I. So what does this P signify? The P signifies protein. The protein is rotten or rot in the nephrotic syndrome. Therefore, the protein is not in the right place. Where is the protein? The protein is in the urea. Therefore, patients who have nephrotic syndrome, the protein is rotten. Therefore, the protein is in the urea, which is not the right place for the protein. The patient suffers with proteinuria. Whereas in nephritic syndrome, the P before the I, the protein is in the right place. That means the protein is not in the urea. So there is no proteinuria. Rather, the other counterpart, which is hematuria, is seen here. Because the protein is in the right place, the blood will not be in the right place, and hematuria is observed in nephritic syndrome. Next is, in nephritic syndrome, the differentiating letter I helps us identify that here there is inflammation of the glomerular basement membrane. Whereas in the nephrotic syndrome, rot helps us identify that the glomerulus here is rotten or damaged. Nephrotic syndrome, rotic, therefore the glomerulus is damaged, as well as there is proteinuria because P is rotten or protein is in the urea. Whereas nephritic syndrome, P is in the right place, therefore protein is not in the urea, there is blood in the urea or hematuria. I suggests inflammation, therefore the glomerular basement membrane in nephritic syndrome is inflamed. I hope this video was helpful in memorizing the differences between nephrotic syndrome and nephritic syndrome. That's all we have for today. Thank you.